Can you just tell us a little bit about what brought you into Claremont?
I just started having knee trouble, mainly from my background. I was a professional sportsman. I was around 20 years old as a powerlifter. So I started doing Island Games, professional wrestling, and one thing and another lent me into World of Strongman, where I ended up competing at World's Strongest Man, Europe's Strongest Man, and I was a professional for 15 years. As I got to the end of my 40s, 50s, started developing a little bit of knee pain when I'd been to the gym, when I'd been for a walk, and then I would think I was about 51, 52 when I noticed my right leg wouldn't straighten as much as what it had done.
And what did you find you were struggling in particular to do with the knee?
Walking, car journeys were particularly difficult. I remember one particular journey just driving back from Manchester Airport. I had to stop on Snake twice. I just got severe pain in my knee, which I just thought were wear and tear or whatever. I didn't think anything about it. Walking my dog, doing breaststroke swimming. I noticed it when I'd been swimming. And then from then on, it was just normal things like walking upstairs. Things just weren't right from then on. What
was your overall impression of the process at Claremont from when I first saw you in clinic all the way through to being discharged, if you like, which you were approximately 6 months ago?
Very easy process, to be honest. I was apprehensive.
Yes.
I didn't know what to expect. But after that first meeting that we sat down and you advised me where we thought we should go, what we should do, obviously I was looking for anything quick fix, anything minor, and then you said, you know, we needed to do a major full knee replacement, and what it entailed, and if I did want to be mobile and agile, the things I got to do. So I think that first hour I walked away from here, and I were positive from then on. It were uplifting because from that moment in time, everything had been sort of doom and gloom.
Yes.
And glass were half empty, and all of a sudden, glass is half full, and I've got a solution to my problem.
And what was it like when you actually came in for your surgery? You were an inpatient, I think, for 2 days, 2 nights here.
It was very similar to just checking into an hotel, if I'm being honest. I just checked in, sat down, put my things away, sat there. I remember looking through a window, it was very, very peaceful. It was just very, very pleasant to come in, it was relaxing.
And how do you think your knee is now? Because I always, or often tell patients they never feel like a normal knee. Why would they? It's an artificial knee. But how do you compare now with how you were 3 or 4 years ago, for example?
I'm more mobile. I'm pain-free. I can't remember what my knee was like 5 years ago. I can only tell you that the knee I got now, the artificial one and the real one, there's not much difference. There's not much difference in range of movement. I don't think about it that much. It just feels part of me. And it just feels more or less same as other one. There's not that much difference at all.
And how much are you doing with the knee? Are you back in the gym?
I don't lift anything like I used to do, but I've kind of got this philosophy where it's construction, not destruction. I do go to the gym, I do the leg exercises, I go bike riding, I swim again, I do everything that I do more now than what I did 5 years ago, with a lot less pain.
Is there anything you would change about the process here at Claremont? Anything, any pointers? We're always looking to pick up tips and change, you know, if change is required.
There were nothing I didn't find pleasurable about this experience coming here, nothing. From walking in, to the people you meet at reception, they've got a smile on their face. It just puts you to everything here. I cannot say enough about it. It were absolutely 11 out of 10. This has been a great success for me. It's given me back my mobility and my life. And when you've been 53 years being active, I didn't retire from professional sport until I was 39, nearly 40. So I probably went on a little bit too long, probably did a bit too much damage. But later on, when you start feeling effects from that, and you're feeling mobile, you feel a bit depressed and down or whatever, and when it comes back, it's uplifting. It's a great experience.
Excellent.